survivorship concerns could be changing. So rather than fertility issues, now you're more concerned about, you know, do you have a genetic link to cancer, and are you passing that on to your kids and that sort of thing. So, so I don't think cancer survivorship is black and white. I think it's very fluid, and I think that the benefit of a multidisciplinary clinic is that we can see that, and we can adapt based on how the survivor presents to us in that moment. And we talk about that very often, about always meeting the patient where they are. And so I think that's one of the keys to what we do with survivorship care. Maura, since you and I have been a work couple for so long, I'm gonna ask you to go next.
Thank you, work husband. So I'm the dietitian, and I joined the clinic shortly after Scott back in 2006. So it's been quite an evolution of a clinic, but also that the survivors taught us what their issues are, and we learned from the survivors. And what I find from a nutrition standpoint is that for many survivors, it's a time for kind of a reset in their lives, a reset of how they're eating, you know, a reset of just their self-care. So it's a great opportunity to get very effective nutrition education in place and targeted changes. So it's a very fluid back and forth exchange, which I really enjoy. I also am board certified in oncology nutrition through the Academy of Nutrition and Dietetics, and that's been a valuable group of colleagues to tap into. So we do a lot of sharing of our experience. So I find survivorship to be a wonderful opportunity for a lot of people to make healthy changes. And so that makes my work very rewarding. So with that being said, I'm going to hand off to Angela.
Okay, hello everybody. Last time my Zoom call dropped right as I was going to introduce myself. So I'm Angela Caralla, and I am the clinical social worker on the team. And I have been a member of this team. It will be 7 years in just a couple of weeks. I cannot believe it. So besides working in the survivorship clinic, I also work in the Smilo Breast Center. And so what survivorship means to me is first of all, I love this part of my job. I just have to say, working with this team and cancer survivors is empowering and very inspirational. But what it means to me is just to be able to provide an opportunity to survivors to be able to talk about the impact that cancer has had and may even still be having, you know, on their lives. As we know, cancer impacts everything, somebody socially, emotionally, spiritually, financially, sexually, and it really crosses over into all areas of their life. And being able to have this multidisciplinary approach is so beneficial to patients. And you will, as we go through the different sessions, you will see how we take a theme and how it really crosses over into all of our areas of expertise, and how we as a team then address that, you know, to meet the patient where they're at. So thank you. Jevin.
All right, thanks, Angela. So I am Jevin. I'm the PA with the Survivorship Program, as many of you already know, and I've gotten lots of emails from me. I started with the team here in July of 2018, so I'm the newest member. Very thankful and fortunate to be with this awesome team. And when I think about the survivorship clinic and think about cancer survivorship as a whole, it makes me think about you know, the number of concerns that don't always go addressed that cancer survivors have. And what I think is great about our multidisciplinary approach is being able to address each of those concerns within our own disciplines, and that's the strength of our program. And really, why that's so powerful is because when we're working with survivors at that point in time, it's helping to empower them and give them the tools to make positive lifestyle changes, so they can be living the best life they can, or at least working towards that. So I'm going to get into that in just a moment here, but I did also want to have Tara, our medical director and the wonderful physician I work with, give a little bit of her thoughts on survivorship.
Thanks, Jevin. Hi, everybody. I haven't eaten all day because I've been on Zoom meetings, so I'm going to be eating goldfish later and drinking water, and I encourage you to do the same if you haven't eaten. Survivorship, I've been with the team since 2010. I came out of fellowship where I had trained in both medical oncology and hospice and palliative medicine. And people would say, well, hospice, palliative care, like what does that have to do with survivorship? And I think it's really simple. To me, it just means taking care of the whole patient. And it's always meant that. So, you know, we have the disease that we're fighting from the moment of diagnosis throughout the balance of someone's life. And then there's all of the other things. And so what our clinic has done is provided that space to listen. It's 2 hours of mostly listening and then taking what we hear and trying to mostly do a mindset intervention, you know, motivate patients to make these changes, make it practical, and give them the support that they need. So it's also my work family. This team is so important to me, and I'm just a better person overall for working with this group. So I'm really excited to get to know all of you better and build this network out even more. Maybe we could have Ashley say a few words before we hop in, because she is a vital component of what we're doing, and she will be our partner in Ohio when she graduates and starts her own clinic.
Thank you. I think a lot of the same echoing that Tara just shared. I got into medicine because it's such a pleasure to be and such a privilege to be a part of somebody's journey, but medicine and chemotherapy is just such a small portion, and I love that survivorship allows me to see and provide so much more to each person and to meet them where they are. And just so excited for our echo sessions, and thank you all for joining us.
Thanks, Ashley. That was great. And thanks, everyone, for giving a little bit about what you think of when you hear the word survivorship. You know, going back to what I had mentioned before, and empowering the person, empowering the survivor, I did want to take a chance to go over one slide we didn't have a chance to address last time, and that was the teachable moment. Again, a lot of what we do, and with the help of my wonderful team, who I would argue does way more than I do even in clinic, they will help talk about exercise and nutrition and mental health related concerns, and provide these individualized tools that survivors can use to be working towards the best life that they want to live. And really, having gone through this cancer journey, survivors are at a point where they're very malleable and they want to be making these lifestyle changes. So we help them do that through, through our visit with them, through the survivorship care plan we provide. And again, these are not concerns that are oftentimes addressed at the time of routine follow-ups. And it's important to use this time for that purpose and allow it to be a teachable moment to maximize overall health and improve quality of life. And so that's what the strength of our program is and what survivorship is. So I'm going to turn it over to Scott to kick off our presentation. That's going to be on the nuts and bolts of our survivorship program and what makes it run.
Also, if I unmute myself. So I know a lot of you are kind of wondering, how do you actually get a survivorship clinic up and running? And truth be told, when we first did this program, this ECHO program back in the fall, it looked a lot different. The world looked a lot different than what it looks like now. And so, obviously, we're respectful of that, how things are changing, you know, but we're going to try to stick to the script as much as possible, you know, but try to put as much of a modern day spin on it as we can. So yeah, go ahead, Jevin. Again, we do this for the love of survivorship. We're not making any money off of this. And again, we're going to take a few minutes just to kind of talk about the survivorship guidelines that are out there, and especially for the PTs that are here in the group, how these national guidelines are changing, and how they actually work to our benefit, and how they can get rolled into survivorship care. We'll talk about, you know, for us specifically, you know, the patient population that we see, who's eligible to attend, and how we get those referrals, how we pay for the clinic. You know, we'll talk about some of the different forms and that sort of thing. And so, you know, again, kind of the, you know, the day-to-day operations of our clinic. So this is really exciting to highlight. The American College of Surgeons puts out this, has this Commission on Cancer, this COC accreditation, and major cancer institutions around the country work really hard to get this Commission on Cancer certification. And these new guidelines have been updated, and they're to take effect January 1, 2021. And it talks specifically about survivorship care, and you can see how that it expands the number of health professionals that need to be involved in survivorship care. So it's not just the medical component anymore, but that they want a minimum of 3 other services to go along with this, which includes social workers, nutritionists and dietitians, and physical therapists. And so you can see how, you know, if a major cancer institution wants to keep this COC accreditation, this Commission on Cancer certification, that they're going to have to be able to provide this multidisciplinary approach in their survivorship care. And so, so that really, you know, so again, for the PTs that are on, you know, that benefits us. And so when we are going to our directors and we're saying, hey, we want to get this program up and running, or I'm a PT and I want to be integrated into a pre-existing survivorship program that may already be at your institution, you can turn to this. And this would help get you in the door so that we really do have this multidisciplinary approach to survivorship care. Okay, so for us here at Smilow Cancer Hospital, we will see any adult over the age of 21 who's been diagnosed with cancer in our clinic. Interestingly, we have a separate pediatric survivorship clinic, which actually predates our survivorship clinics, called the Heroes Clinic. So that's specifically for pediatric cancer survivors. And a lot of times they will follow those pediatric cancer survivors as they transition into adulthood, obviously because those are very specific protocols that the pediatric patient undertakes. So it is a little bit of a gray area. I mean, once in a blue moon, there might be some crossover with our clinic, but by and large, we will be taking adults from the age of 21 on from diagnosis. But we are open to any cancer types. Our highest prevalence is breast cancer, but we will see any diagnosis that's out there, and including the maintenance therapy, the hormone therapies that people may be on. We'll definitely see those cancer survivors. You know, on a case-by-case basis, we will see somebody who does have metastatic disease, and then also Dr. Sampt, parallel with our survivorship clinic, we'll see patients in what is called a long-term follow-up clinic. So survivors who have been 5 years or longer out from their diagnosis as well. And so the big question is, how do we get survivors to come to our survivorship clinic? And honestly, we have wrestled with that question since day one. You know, initially when we were starting our survivorship clinic, and Dr. Ken Miller was our first physician who was charged with starting this clinic. You know, he was new to Yale, and so to get some of these referrals was hard because some physicians saw it as poaching of patients, and so a lot of it was education early on to tell the other providers, we're not taking your patients from you. You know, this is a complimentary service to complete the whole picture of cancer care. So we're not stealing patients away from you. You know, you're still the primary oncologist, but we are here to help kind of fill in the holes, so to speak. And then when we went to a formal EMR system, we use Epic at Yale, New Haven, and at Smilow Cancer Hospital. We've been able to build in an actual thing where you can actually check off for a survivorship clinic. So the provider can check that off. So you can see right there, it's circled the Smilow survivorship team. And so that helps to generate the referrals right from the providers. And then Maura and Dr. Samt have been working very hard over the past couple of years on a series of funded studies, nationally funded studies called the LEAN study, looking at the effects of weight gain and weight loss in breast cancer survivors. And in their most current form of that study, part of the study, part of the usual care and control care is that the breast cancer survivor who's in this study actually gets a referral to the survivorship clinic. And so, you know, if you work at an institution, you know, where you have, you know, some of these other studies going on, that could also be a way to try to get more referrals if you can work with that team to say, hey, you know, as part of your, you know, as part of this study, either usual care or control care or both, that's an option to explore as well. Another big question that we always get asked is, how do you pay for it? Especially for our clinic, with a multidisciplinary clinic, there's 4 providers. And so it would be cost prohibitive if somebody had to pay 4 copays just to see all of us. So the next slide, we'll talk a little bit more about the funding. But the way that we do it right now is that we bill through Jevon. We bill through the medical component of the clinic visit, and it's billed as a 25-minute follow-up visit. My time, Angela's time, and Maura's time come from different departments, and also are supported by the cancer hospital and by philanthropic efforts as well. I will take a 30-second timeout here because I know Maura always likes to bring this point up, that our survivorship clinic was actually founded by survivors for survivors. And so the initial seed money that got this clinic going in 2006 was from a benefit bike ride. And over a couple of years, it generated $2 million that was given to Yale Cancer Center to get this clinic going. And then when Smilow Cancer Hospital came into existence in 2009, Smilow Cancer Hospital took it over, and through their benefit bike ride every year, that's where we get a lot of the funding to keep our doors open and to, again, keep the costs down so that our survivors can come. Or you gotta unmute yourself.
Still learning. Okay, so thank you. So our survivorship clinic, I kind of refer to it as the dog and pony show, because we kind of take our act and take it on the road to reach more survivors. So when we started the first clinic, we didn't even have the cancer hospital built yet. And then when it was built, we moved, we got a spot there. And as you know, space is always at a premium. So space is a problem, but also people didn't want to come into New Haven and deal with the city and the parking, and that was a deterrent to coming into Smilow for the survivorship services. Also, they didn't want to necessarily come to where they received their treatment. Once they're done, so a lot of survivors just say, I don't want to go back to where I had my infusions. They want a non-clinical space. So we then started branching out into the different care centers in the Yale Cancer Center as a way to go out to the community and reach more survivors. So we now have, our clinic is held every Wednesday, and we rotate among the different care centers every Wednesday. But now, given the COVID restrictions, we're all through telehealth. So now it's wide open. I think this provides even more opportunity to reach more people. So we have a telemed component through our Epic medical record. And again, the technology is, everyone's on a learning curve, but I think it works pretty well. And I think it expands our reach. So the next slide. So there is, when you're looking at space, ideally you want a consultative space for these services, not a clinic exam room space. You can see the difference. Just again, to put the survivor at ease. But beggars can't be choosers. We'll take any space anyone gives us, and we're very nimble and mobile, and we carry our offices with us and all our materials, and we are grateful for the space we're given. So, but in an ideal world, Scott and I always dream about, if we had an ideal clinic, it would be a non-clinical space. We would love to have access to a gym. We would love to have access to a kitchen, a small kitchen, so that it could be real hands-on education and demonstration. I would love a garden, therapeutic, to do some therapeutic gardening, and space to support for support groups, and a relaxation and serenity area for meditation and mindfulness. So dream big, envision what you want, and then try to find the space to make that happen and advocate for that space. We continue to do so. And as I said, we've had to be very creative to bring our services to more survivors. Okay, now we're going to switch gears and go through what are the intake forms that we use at the clinic.
Okay, I guess I'm up, right? Okay, hello everybody. I'm having a hard time with my view of how this looks on my screen, so just give me just a second. I'm really sorry about that. Okay, so prior to survivors coming to our clinic, they are sent a packet of intake forms. And within that packet, one of the forms asks them to identify their top 2 concerns that they would like to address while they're at the clinic. And this is really helpful, particularly because the survivors have about 30 minutes with each one of us. And it really helps us to be able to individualize and customize and address the needs of the patient while they're at our clinic. And I find this to be extremely helpful. And then the survivors return the forms in advance, and then that gives us an opportunity to review this information ahead of time as a team. And we have a huddle typically in the mornings before we start our clinic. And it gives us a chance to talk about and strategize how to best utilize the survivors' time and meet their needs during their visit. This is the top 2 concerns here. And they can rate their overall level of well-being on a scale from 0 to 6. And this again helps us to really target and provide, individualized care to the patient.
Angela, I'm gonna step in here for just a second. Your video feed is cutting out, and it's difficult to hear you. I'm gonna just for the sake of hearing you better, I'm gonna stop the video for you and see if that helps. Are you still there?
you hear me okay?
Yes, now I can hear you crystal clear. Angela? Oh no. Okay. I think we might have lost. Oh no, I see her here. Let me unmute her. Angela, can you?
Yes.
All right, I can hear you.
Okay, so that's fine if you can't see me. Do you want to go to the next slide?
Next slide it is. All right.
Okay,
Yep.
so this is the distress thermometer. And so for those of you who are not familiar with this, the distress thermometer was developed, I believe, in like 1998, 1999. The NCCN, the National Comprehensive Cancer Network, developed this tool. It's reliable, it's valid, it's written in many, many different languages. What's great about this tool is it's self-administered. It allows the patient to rate their level of distress within the green, zero being no distress. And then on the right-hand side here, you can see that they're able to identify areas of distress within the context of a problem list. I really, really like utilizing the distress thermometer when I'm meeting with patients, because it helps me, again, be able to individualize my time with them. Since I only have about 30 minutes, I'm really able to meet their needs when I'm, talking to them. It's important to note that NCCN has determined that anybody who rates themselves a 4 or above is considered to be moderate to severe distress and requires some level of intervention. Also, I believe in 2012, the American Surgeons, American College of Surgeons Commission. Sorry, I'm getting a little tongue-tied there. This became a part of the accreditation standards for cancer. And so really anybody who is part of a National Comprehensive Cancer Center, you're probably very familiar with this tool, and it's been utilized with your patients.
All right, Scott, go ahead.
Yeah, so as far as the intake form that I use, I've deferred to the MD Anderson's brief fatigue inventory, because I like to get a sense of where this person is as far as their energy level or their fatigue is. Again, this is a validated tool, and also, again, for the PTs on the call today, the BFI has also been recommended by the Academy of Oncologic Physical Therapy through their EDGE task force. So if you go to the Academy's website and you see the task force recommendations of different screening tools that we're supposed to be using, they do recommend using that. So to try to be in alignment with our own academy, I use this. And so just quickly, you take it, you add it up, average it out. Anything between an average score of 4 to 6 is considered moderate fatigue. Anything that averages out to 7 or higher is considered high or clinically significant fatigue. And one of the other things that, one of the other intake forms that we will use, and this is good for all members of our team, is the functional assessment of cancer therapy, the FACT scales. And the first 2 pages of this are universal, and it has 4 subsections. And again, for us PTs, like the first section is physical well-being, asking about lack of energy and nausea. Then there's social sections as well. But then there is a 3rd page, which is disease specific. So for somebody who is a breast cancer survivor, we would give them a FACT-B for breast cancer. And so it's a lot more specific as far as, like, do you have swelling in your arm? Do you have limitations in raising your arm? Do you feel like a woman? Like those types of very specific questions. For a guy who has prostate cancer, so there would be a FACT-P for prostate cancer. And again, those are very specific questions for that particular disease site. So so again, we'll know who's coming in, and we'll give them their specific FACT questionnaire, so that it really helps lead us, down the road as to where we need to be focusing our attentions.
Oh no, Maura, we can't hear you. 1 second. I was trying to unmute you and it's not even letting me. There you go.
Okay. As official timekeeper, we have 25 minutes left, team.
Okay.
So now we do this detailed questionnaire for supplements and herbal preparations, because this is a very unique problem to survivorship. There's a high usage of supplements and herbal preparations among survivors, and higher than normal population. And this often is not reported and not asked about. And the concern is that many of these supplements and herbal preparations can actually have an interaction with other medications that the patient's taking. So there is a real safety concern here. And there's also this misconception that this is a good thing. So patients come in often to see me to say, what supplements should I be taking? Not what foods should I be eating? So there's a real misperception out there as to what good nutrition is. So this is a very useful tool to gather that information. And if someone comes in and they're a very high user, well, then that becomes the focus of the nutrition consult. Why are you taking this? What do you need? What don't you need? And kind of teasing that out. You have to still honor their belief system because they're taking it for a reason. So you need to know, why are they taking it? And my job is make sure they're doing no harm first. So I'm checking interactions, I'm checking high dosages, I'm checking multiple preparations of a particular nutrient that can add up to a toxic level. But we've developed this form, and we spelled out a lot of these preparations because people don't remember what they're taking. So this really prompts them. Oh, I'm doing this. Okay. Sorry. Then when the person leaves, we ask them to kind of give us a report card. And we start again with they came in with their two primary concerns. And we said, so how did we do? Did we address your concerns? And what did you find helpful? What did you need more of? You know, what did you get too much of? So this was very informative for us to get a sense of how we're doing. And this is really how it evolved, that we kind of came up with this two top concern approach, because it allows us to really kind of hone in on what are their concerns as they present to us, and really, and it helps. We feel this is why we get their distress thermometer to go down at the end of the visit, because we really do address what their concerns are when they come in.
Hi everyone, Jevin here again. So as Angela mentioned before, we do a pre-visit huddle. That's when we take the opportunity to review the survivorship treatment summaries for the survivors we're seeing that day, and we'll review the intake form as well as the pre-screening forms they fill out before the visit. So again, the intake is filled out prior to the visit. The rest of the forms that we just went through are filled out at the time of the visit, just before they see each of us. And this allows us to come up with an idea of how we're going to approach that person that day, what concerns they have coming in, and helps us to develop a plan. We do refer to a number of different services, and that's you know, a large part of my role in the clinic in particular. You know, whether it's for sexual health concerns, referring to our sexuality, intimacy, and menopause symptom clinic. We refer to physical therapy if they would benefit from outpatient physical therapy. We can refer to genetics if they haven't had genetic counseling and it seems like it would be beneficial to them, and that's something they wish to pursue, be it for themselves or their family. And what's great about our program is that we can utilize the network that we have and the resources that we have to build this individualized plan for them, reaching out to services maybe in their area or other services at Yale. And a large component of what I do is a survivorship care plan, and I help to develop this ahead of the time of the visit. I'm not going to go through this page by page or anything like that, but know that generally speaking, the front part of it is going to be the treatment summary, and that includes a person's contact information, their care team, their diagnosis, the treatment they received. And then, oh, Angela, go ahead.
Hi, we have a question.
Yeah.
Are you ready to take a question?
Sure, I can take a question now.
All right, so this is from Erica. She says in a question, at Middlesex Health, survivorship can be accessed at any stage of care. Do you have patients that receive survivorship care after treatment? Also, we have a nurse who is a member of the Cancer Center staff who handles survivorship and is essentially the gatekeeper to help patients access services, nutrition, rehab, etc. Is there a primary contact within your team?
Yes, so it sounds like, you know, Erica, you're asking about when survivorship care is provided after treatment, and then is there a primary contact for our team? So yes, we do have, talking about the contact, we have a phone number, and our program coordinator, Kiki, her name's Angelique, she goes by Kiki. She unfortunately couldn't be here with us today, but she is our frontline person who discusses the ins and outs of the clinic when introducing it to people when they call for an appointment or when she calls them to schedule an appointment. And I'm happy to speak with them as well, but we do have a central number for that. Additionally, after someone's completed their active treatment, they would be eligible to be referred, and this includes things like chemotherapy, radiation, and of course surgery as well that they may have had. And if they're on, you know, maintenance endocrine therapy or some sort of other maintenance therapy, like say an immunotherapy, they're certainly welcome to come as well, as Scott mentioned before. So referrals can be made by the person themselves, just calling in, inquiring about our clinic, or it can be placed by any provider, be it anywhere, any provider in our system, or through our system itself, we have that Epic generated referral. What's unique about our breast center at Smilow Cancer Hospital at Yale is that we actually have our nurse navigator at the time of their initial diagnosis and first appointment place the referral, and we follow up with them based on their timeline of treatment thereafter. So that's another way to generate referrals too.
Yeah,
and create access.
And I would say too, also, Jevin, that I know you and Dr. Samp, you guys have worked tirelessly to create these relationships, you know, with the other teams within our network. You know, I know Dr. Samp, you know, you're very tied in with, you know, with the upper management, and so you are able to get the word out to all of your colleagues at that level. Jevin, I know that you have personally met with the BMT team and some of the other teams, you know, throughout the Smilo network, and so a lot of that also is relationship building, and you know, as we build these relationships with other providers, you know, that has helped as well. So I don't think you can undersell you know, the personal touch of reaching out to somebody as well.
Exactly, couldn't say it better myself. And I know just from speaking with some of you here today, joining for this for the call, you know, that it's through your efforts to reach out and want to be involved. And it's about identifying those survivorship champions in the different departments, and really breaking down those barriers that allow us to be siloed. So
you know, not to just a word of encouragement and to stay strong and don't get discouraged. I've been here 10 years. I had to go back to the faculty and the staff many times to remind them that we're here. And I just got an email yesterday saying that somebody has interest in starting a wellness program focused on diet and exercise and mental health counseling after cancer. And I said, oh, well, it sounds exactly like our clinic that you've never sent a patient to. So anyway, we're all here together. We're here to support each other. It's a hard hill to climb.
Thanks, Tara. Yeah, certainly is. Just to get back to the presentation, just to finish this up quickly, talking about the care plan, also there are follow-up recommendations on the back end of this, healthy lifestyle recommendations, health maintenance and screening, and then follow-up per the oncology team that the person's following up with. On average, it takes 30 to 90 minutes to complete if you're very proficient at it. For example, working at the breast center as well, I can work through a breast cancer survivor's care plan and complete that in 15 to 20 minutes. So it also is about familiarity, and there are a number of barriers too that I'm happy to talk with you about in the discussion. There are several versions. You can find them online through ASCO, Journey Forward, and OncoLink, amongst others.
Hey, Jevin, before you go on, Michelle just asked a question in the chat about our patients that they may have metastatic disease who do come and see us. And so, you know, we will see just about everybody, stage 1, 2, 3, 4. You know, a lot of times, you know, somebody who may have metastatic disease, you know, we may have that conversation, you know, with the referring provider before we go forward with that. But, you know, I would say that, you know, we are not going to close our doors to anybody. You know, and there have even been instances where, you know, again, if a provider comes to us and says, I have somebody who is, you know, they had surgery and they've had chemotherapy and they're about to start radiation, but they could really use you guys. You know, we will take that on a case-by-case basis.
Yeah, I'd just like to, again, as timekeeper, I just want to say we have about 10 minutes left. So I'd really like to open it up to all participants and raise your hand or type in the chat room, but we'd love to answer your questions.
Angela, I don't know, I saw you had raised your hand with someone maybe in the chat, or did Scott get that?
Well, Scott got that. Yeah.
Okay, perfect.
So yeah, I was just alerting you to that.
Sure, thanks. Yes, go ahead, Elizabeth. I'm gonna unmute you. Oh. That's so strange. I don't know if you can unmute yourself there. It's not letting me unmute you. Not sure why.
How's that?
Perfect, thank you.
Okay, yeah, good. So I've been trying to find the Journey Forward care plans, and every way I try to find it, it says that they're no longer available. Do you have any idea about that?
Yeah, I think they actually just discontinued them recently. So my understanding is they are not actually going to be available anymore. I don't actually know if Livestrong is still available.
I couldn't find that one either. I did do the OncoLink, which I think is that's pretty cool. I'm not, does anybody have any experience using that? I'm just trying to figure out like the operationalizing of it, because I don't think you can print things off, or if you did, it would be a book. It's more interactive, it seems.
So we have experience before Jevin got here, so I can speak to that. We used, it used to be Livestrong, now it's OncoLink. And it is a really nice platform. It's free. And you can, the pros is that it's really quick. It's like just radio buttons that you click through, and then it spits out a survivorship care plan. There's they've refined it over the years, so there is a healthcare provider one that shortens all of that, but again, it's more meant for healthcare professionals. And then there's a patient facing one, which you're correct, when you print that, it's going to be 20 pages. We did a focus group using this, using various templates, and actually that one, the patients liked it. They liked all that information. And then Epic came along, and Epic has its own template and tons of challenges with it, but we ended up going with it so that it lived in the EMR. So the con about OncoLink is it doesn't live then in the EMR, but it's quick, and it does provide a lot of information to patients.
Okay, good, thank you.
Thanks, Elizabeth, good question. Other questions or comments? Michelle, go ahead.
I know physical therapists are involved with lymphedema and all that as well, and a lot of the functional things, but do you guys have an OT that you've included at all, or? Oh, Heather, are you the OT?
Now we do now.
Yes.
Yay!
Yes,
'Cause we
so
have an
yeah,
OT
so
that does so much of the lymphedema. I want to make
So,
sure.
yeah, I've actually done almost all of our oncology for the rehab side of it, care for all of the breast cancer patients physically. I don't anymore, my role changed, but, and our PTs typically would do, because I was lymphedema certified and myofascial certified, it just sort of dominoed into my seeing mostly the breast patients. And on our PT side, they would see all the other cancers for balance and a lot of those other things. So we kind of separated it that way. But just, I see your comment, and I know you just to ask about the stage 4 not qualifying for survivorship. I see a lot of stage 4 patients, and they're all considered, you know, to come in, and they can be evaluated by our physiatrist, does the evaluations for our survivors coming in who need rehab or any of the services. And we've had many stage 4 patients, so.
Well, I guess in our rehab clinic, they'll see people who are stage 4. But we were on a tumor board call the other day, and someone was stage 4, and they had just finished radiation. And I said, are they ready for their survivorship evaluation or appointment? They said, well, no, they're stage 4, so they don't need the survivorship program. If they needed PT,
They might need
or
certain
OT
pieces
or
of
something.
it.
Right, exactly. But it would be nice if the whole team would have been able to evaluate that person
Yeah,
in the context of survivorship. Because even if
Right.
if
They
you
still
only
have
have a
some
month
life to
or
live.
2 months, you're still got to survive.
right.
yeah, I think, you know, we're challenged a bit by our nomenclature. The choice of the word survivor has so many different historical meanings, kind of like palliative care. So, you know, I think that I've even heard of lung cancer doctors who won't send their stage 3 patients because their risk of recurrence is so high that to even consider a survivorship clinic doesn't make any sense. And, you know, so I wish that we could really spread the word. This is about, you know, optimizing your health during and through cancer, you know, and so, you know, ideas on that from you guys would also be helpful. But we do see, and, you know, the prognosis has changed a lot. So even lung cancer patients are surviving stage 4, long-term durable survival. So I think they'll catch up with us, but it's a real concern, and it's something that we've heard here too.
One more quick question, and then I won't ask anymore. But in the same context, we've heard a lot about stage 3, stage 4 patients whose caregivers are going through burnout and things. So do you guys have anything? Do the caregivers come? Do you do any sort of a stress survey or fatigue survey for the caregivers, and then have resources for them as well?
We have at our hospital, we have a caregiver cafe. So they can come in. We have this little area that's set up for them that our social workers set up, and it had coffee and muffins, and it was open during certain times. So if somebody was coming to drop off a patient for an appointment, they could go in there and relax for a little while, or the social worker would make herself available so that she could be in there during those times so caregivers could go in. So it was cute.
We encourage caregivers to come to the visits, and they benefit from the same, you know, you're more likely to have those healthy behaviors change if both of them or all of them are listening. Oops.
And just another comment on caregivers there. I think part of what Scott alluded to before with this being, you know, this involving the caregivers too, hearing some of these recommendations from the team and for survivorship care is beneficial, right? Because they can one, help, hold the person accountable, and two, the survivor also has that level of support and realizes it's not all on their shoulders. So if they're at the visit too, it's really helpful. So there is that benefit to having them involved.
And I'll add, from a nutrition perspective, it's really helpful to have other family members in on the session. Because when a person's trying to change their nutrition habits, it's hard to do it by yourself when you live in a household with other people. So you have to get buy-in from the other household members. And often that's one of the biggest obstacles. So if you can get buy-in, at least to have the other household members understand what this person's trying to do and support it, not fight it. So that's helpful.
Yeah, and likewise for exercise too is, if you, when gyms were open, to say, oh, like you can go to the gym together, but you can do separate workouts, or you can now, you can go for a walk together, exercise together. Again, that accountability is really important. So yeah, so whenever we can include the caregivers, we will.
And just from the social work perspective, I have to apologize. I got to sign off because I got to get to an appointment in about 15 minutes. But with social work, I have found I like to offer the patients an opportunity to speak with me privately, because so often with what they're dealing with on an emotional level, sometimes they don't want their family member or loved one to hear how they're actually thinking and feeling. And so if a patient does have a caregiver or a loved one with them during the appointment, I always start off my visit that way and say, I'm here to provide support. I can speak with you privately. If you want your family member to stay, that's fine too. So I give them that chance as well. So, and thank you guys, I gotta go. So Scott, can you manage the chat?
Thank you.
Okay, bye-bye.
Thanks, Angela.
Bye-bye.
And yes, and to be mindful of everybody's time, it's 3:58 East Coast time. So we'll start to wrap up here. We'll see you guys all again in 2 weeks. The next couple of sessions, we're going to be diving into some of the common themes that we have seen in our survivorship clinic over the years, and we're going to talk about how each of us brings our unique perspective to those common themes. So we're going to be, over the next 3 sessions, we're going to be talking about cancer-related fatigue, weight management, and fear of recurrence. And you're going to hear how the medical component contributes to that, how dietary contributes to that, social work and physical therapy, how we all come together through our lens of practice to address those concerns. So we want to make sure that that you guys all join us. We will have a case study at our next one, and we hope that prompts you guys to start thinking about different cases that you've seen, different patients that you have come across in survivorship or in your regular practice, because we would like you guys to interact with us as well and kind of bring those cases forward to us as well. So again, yeah, we wanted to, again, make sure that, you guys stay with us over the next couple of sessions. The next one will be 2 Wednesdays from now, again, 3 o'clock East Coast time. Jevin, Maura, Dr. Samps, anything else I forget there?
Now you know I have 3 children, and yeah, we want to hear from you guys. Bring your questions, bring what you've seen, what works for you. I think the goal should be a dialogue. So I'm excited to see you again in just a few weeks.
Yeah, I agree. I think the goal is to have an open dialogue, open discussion, and we're excited. I try to provide a template with the case presentation form, but don't feel obligated to follow that specifically. If you wish to, I'm happy to go through it with you, go through a mock presentation if that's what you want to do. But you're welcome to come just, during the session, bring up, a case maybe you've had in your own clinic. And as long as you're excluding any protected health information, you're good to go there. And then I will send along the post-session survey in the email following up this session. And that really helps us get an idea of what we could do better, how, you know, this has been helpful, and if it's been helpful, right along with every session here. So thank you for that, and thank you for hanging with us through it all. Maura, I don't know if you had any parting words.
Just that I think one thing we've learned over the many years of the clinic is how to reframe problems, reframe issues, and give very healthy messaging. So that's something we can impart to you. So if you could bring concerns to us and we could explain how we can, how we reframe issues for patients, that helps change their, make it not an obstacle, like, oh, okay, I look at it this way, now it's an opportunity. So we can provide that for you also. So we're all looking forward to continue to work with you over the next 4 sessions.
And I know we're about a minute over, but I wanted to share one slide with you here. And the person in the slide might look familiar to you based on the hair. Maura, do you want to explain what this was and when this was?
Well, I have my personal physical therapist trainer, Scott, who gets me ready for the Closer to Free ride. So I rode in Closer to Free, and I wore the ribbons of the names of all the women who are in the lean study. So I had over 200 names that I carried with me on the ride. So it was to ride in their honor.
Yeah, she went flying past me. She was in great shape last September, and all I see is all these ribbons just kind of bouncing around, and then she just like took off. She was powered by all these ribbons on her back. It was pretty amazing.
So we get a lot from our survivors. They really energize us. So with that, I say I bid you all adieu and see you in 2 weeks.
Stay well, everybody. Great to see
All right.
you. Thank
Take
you.
care, everybody.
Bye.
Hey, Jevin, Heather and I are going to stay on for a couple minutes to talk about Survivorship Day.
Perfect. I'm
So
happy to stay on too.
So if you can leave the call going.